So there are two types of diabetes, type 1 and type 2. Previously they were known as JOD, or juvenile onset diabetes, and the second one was MOD, or maturity onset diabetes. Type 2 typically occurs in the later years and is typically related to a poor diet and lack of exercise, and is typically treated with oral medication, but insulin is sometimes utilized as well.
With type 2 diabetes, it's usually a more obese person who is not producing enough insulin for the body. Usually the insulin is not enough for their body because they've gained so much fat tissue and they just don't produce enough insulin for the body's capacity.
Type 1 diabetes is typically the type of disease that occurs and manifests in childhood and is related to an absolute deficiency of insulin and is typically treated with insulin injections.
Typical symptoms of diabetes include getting really thirsty, drinking a lot, urinating a lot when the sugars are too high. Other symptoms can be feeling really tired initially, can initially lose weight, but then later on, if there's too much insulin, they gain weight later on as well, but initially they lose weight. Other symptoms of diabetes is changes in vision. They sometimes have blurry visions, change in visions. Later on, symptoms of diabetes including numbness and tingling in the hands or the feet, and there's a lot of other complications that are involved too.
The majority of people do not have symptoms, and one should not wait for symptoms before considering the diagnosis of diabetes, in that the disease has to be fairly far advanced before the symptoms will typically manifest.
So if you have the symptoms of diabetes, go to your primary care provider and make sure to get tested for, see if you have diabetes. You can get a sugar test done, a fasting test of glucose, or you can get a 3-month average blood test, the hemoglobin A1C, to see if you're at risk for diabetes.
The blood test is very accurate and easy, and it's best if it's done in the fasting state. That is nothing but water for 10 hours prior to the blood sample.
Having diabetes really changes their person's lifestyle because they have to be watching what they eat. They have to look at the amount of carbohydrates they eat, the amount of sugary items they eat, and avoiding those items that causes really fast sugar spikes. It really changes their lifestyle.
I like to think of diabetes as a wake-up call. Dietary modification, that is eating the right things, go a long way, as well as regular aerobic exercise. Diabetes is a very treatable disease, and when it is treated appropriately, the risk of any other diseases, what we call comorbidities, is significantly reduced. On the other hand, uncontrolled diabetes can cause many other disease states to manifest much more seriously and much earlier than otherwise.